Tetanus, also known as lockjaw, is a disease which is caused by an anaerobic, a bacteria requiring low oxygen for survival, bacteria found in soil called Clostridium tetani. This disease is often fatal in horses, hence the reason for the vaccine method of prevention. All mammals, including humans and horses, live in an environment in which minor cuts, scrapes or puncture wounds can occur. These various wound types give an opportunity to the Clostridium tetani bacteria to prosper and cause an infection to surrounding tissue and spreading systemically to other types of tissue. Tetanus vaccine is a preventative measure given to mammals, both human and equine, to protect against the tetanus disease. Allergies to this commonly administered, sometimes annual, vaccine are commonly called adverse reactions, which vary in intensity. There are various symptoms which can signal a systemic or adverse reaction, or allergy to the vaccine after administration. Here are some of the symptoms which may vary in intensity: mild swelling at injection site, vague stiffness, reluctance to move, malaise, slight fever, body aches, colic, muscle spasms of the head and neck, causing problems with chewing, nostril flaring, wide-eyed expression, trembling, violent whole-body spasms when startled, seizures and convulsions, liver damage. There are only two types of tetanus vaccines, which are given to horses, and one has been associated with more adverse reactions than the other. Tetanus toxoid, inactivated virus vaccine. This vaccine has less adverse reactions reported, and many veterinary professionals recommend this vaccine over the antitoxin type tetanus antitoxin, modified live virus vaccine. This vaccine has more adverse reactions reported than those of tetanus toxoid type and can be an ingredient in some equine feeds. Causes of tetanus vaccine: allergy in horses. While the actual cause of the tetanus disease is the bacterial action of the Clostridium tetani, here is what is happening inside the body of the host. The host sustains an injury, puncture, wound, deep cut or abrasion which is not properly cleansed and sanitized. The bacteria, found living in the soils of our environment, utilizes the opportunity to enter the body via the deep wound, and infection ensues within the body of the host. Infection, if not treated appropriately and timely, spreads from the initial injury site to the surrounding tissue as well as to other areas and vital organs in the body of the host. The bacteria, having an incubation period of 1 to 3 weeks, has most likely already healed by the time symptoms present. Ongoing damage can occur to the neurological system as well as the hepatic, liver, system, which can lead to death without treatment. While the actual causes of the adverse reactions are not definitively known, many veterinary professionals believe that the causes are rooted in the immune system and its response to the vaccine, especially as these responses apply to concurrent viruses or diseases in the host at the time of vaccination, could be related to multiple vaccines given in close proximity to each other. Over-vaccination with tetanus vaccines. Diagnosis of tetanus vaccine allergy in horses. Because the tetanus disease can be fatal if not treated appropriately and timely, and because the adverse, allergic, reactions can be severe as well as potentially deadly, it is important to get your veterinary professional involved as early as possible after discovery of the above symptoms, regardless of their intensity. If your veterinary professional can assess your equine early enough, a better chance exists for appropriate diagnosis and treatment of possible tetanus vaccine adverse reactions in your horse before they progress to a point at which they become life-threatening for the horse. Your complete history of symptoms, feeding regimen, pasturing habits, injuries, and if any treatments of those injuries were utilized on your horse, and the duration of the symptoms noted will aid your vet in his ultimate diagnosis. He will need to do a physical examination and will probably order blood testing and perhaps other tissue sample testing. He will be looking for blood chemistries that reflect a bacterial infection being present. An appropriate treatment plan will be developed and initiated when all of this information has been collated.